Heart failure doesn't happen suddenly. In many cases, your body starts warning you weeks, months, or even sometimes years earlier. But most people ignore these signs because they feel unrelated or just part of getting older. But here's the problem. By the time these symptoms feel serious, the condition is often already advanced. Hello, I'm Dr. Rehan Omer. I'm a consultant cardiologist and I'm a heart failure expert. Over the years, I've seen many patients come in late, not because the symptoms weren't there, but because they ignored them and they didn't recognize what those symptoms meant. Today, I want to walk you through 7 early warning signs doctors pay close attention to, because one of these signs is often dismissed the most, but it's one of the strongest indicators. Sign number 1, shortness of breath. Let's start with something very common. Feeling slightly breathless doing activities that used to feel easy, like for example walking, climbing stairs, even light household work. Here's the medical explanation. Your heart's job is to pump oxygen-rich blood throughout your body, but when the heart becomes less efficient, your body tries to compensate. You may breathe faster or feel like you can't get enough air. This is where people make a mistake. They assume I'm just getting older. Occasional breathlessness can happen to anybody, but if it's new or gradually getting worse, that's a sign worth paying attention to. The second sign is persistent fatigue. Not just feeling tired after a long day, but a deeper, ongoing lack of energy. When the heart pumps less efficiently, muscles receive less oxygen. Therefore, even simple tasks can feel unusually exhausting. And here's what surprises many people. Fatigue from heart-related issues often does not feel dramatic. It feels subtle, gradual, easy to ignore. Sign number 3, swollen ankles. Swelling feet or ankles is another early sign doctors should look for, and they watch them closely. When circulation slows down, fluid can begin to accumulate in the lower body. Gravity pulls it downwards, so it shows up earlier in your ankles first. But here's something important. Not all swelling is serious. Swelling after a long day of sitting, that can be normal, but swelling that happens regularly, which persists even when the patient wakes up in the morning and aggravates or does not aggravate throughout the day but does not decrease, or worsens over the day or doesn't go away easily, deserves spatial attention. Now, the next sign on this list is the one many cardiologists consider spatially important, and most people completely overlook it, and that is persistent cough. A long-lasting cough, especially at night or when lying down, which is known as nocturnal or paroxysmal, or when the patient lies down, this is very sinister and this should be given spatial attention. Fluid can build up in the lungs. When the heart isn't pumping efficiently, this can trigger coughing. And this is where it gets confusing, because many people think it's just a cold or allergy. Occasional coughing is normal, but persistent cough, especially with other symptoms, should not be ignored. Sign number 5, rapid or irregular heartbeat. You may notice your heart racing, fluttering, or beating irregularly. When the heart struggles to pump effectively, it may try to compensate by beating faster. But here's the key detail. It's not just about feeling your heartbeat, it's about the frequency, consistency, and change of these beats over time. Sign number 6, reduced exercise tolerance. Things that used to feel easy in the past have now started becoming difficult. Walking shorter distances, needing more breaks, slowing down without a clear reason. So all these aspects are indirect evidence that patients do have an underlying cardiovascular pathology, most probably heart failure. This often reflects reduced cardiovascular efficiency. Your body is working harder to do less. And this is where people often who were normal previously, now they decline that they have got any pathology, and they assume this is just aging. The correction is, aging does not affect stamina, but sudden or noticeable changes should always be evaluated. Sign number 7, sudden weight gain. This one surprises many people. Gaining weight quickly over just a few days. This is not a normal sign. This is normal, not fat gain. It's often fluid retention. If weight increases rapidly without changes in diet, that may reflect changes in how the body is handling fluid. Now, this is critical. It's not just one symptom. One symptom alone can have many explanations, but when multiple symptoms appear together, like breathlessness, fatigue, swelling, reduced activity, when these occurs in concert, the pattern becomes meaningful. Let me discuss a patient's story. A patient in his 70s came in with fatigue, swollen ankles, difficulty walking. He thought that was just aging, but when we evaluated further, these were early signs of changes in heart function. Because it was caught early, he was able to begin treatment sooner and started developing improvement. That's the difference awareness makes. So here is something important to remember. These signs do not confirm heart failure, but ignoring them can delay diagnosis. And in heart health, time is muscle. In the next video, we'll talk about something many people never consider, a sleeping habit that may affect your heart every single night. Make sure you watch that next video, because what you do while sleeping might matter more than you ever think.